hemoglobin concentration in the RBC is reduced. So what happens to then? So what is the cutoff point? Below a certain cutoff point. Cutoff point is 2 standard deviation below the population mean. You have to know the statistics now in the CBME. 2 standard deviation means 3rd to 97th centile. 2 standard deviation below the population mean with a comparable age and sex. So that is the definition. For practical purpose, again RBC mass less than 2 standard deviation or hemoglobin concentration less than 2 standard deviation, both are coming same. What is physiological definition? I mean how body physiology reacts to anemia. Anemia leads to hypoxia. So any condition with reduced hemoglobin concentration or reduced RBC leading to hypoxia is anemia. This is physiological definition, right? Clear to? So now clinically তোমরা কিন্তু আরেকটা জিনিস পাবে, that is called pallor. Then what is the difference between pallor and anemia? What is pallor? Pallor is paleness of the body, maybe skin or mucosa or both, right? So what is the difference between pallor and anemia? Symptom also. It may be a symptom also. What is the difference between sign and symptom? Symptom you get on history and sign you elicit, right? Because mother may come and say, my child is looking pale. So now it is a symptom. Mother didn't complain of anything, or the parents, whatever might be, don't take it, otherwise father may also come with the child. So, and if you find, in spite of no complaint at all, that the baby is pale, that becomes a sign, right? So the difference between pallor and anemia is a sign, obviously, and that's a symptom or sign, whatever might be. Pallor is paleness of the body. So you have to find out condition when there is pallor but no anemia, or anemia without pallor. There is no pallor but anemia is there. Pallor usually goes side by side with anemia, top. So how the skin color is determined? One is the pigmentation on the skin surface. Second, thickness of the skin. Third, diameter of the blood vessel underlying the skin. Fourth, amount of blood supply in the skin. Fifth, oxygen capacity, oxyhemoglobin concentration of the blood. So all these parameters together gives color to the skin, right? So anemia is reduced hemoglobin carrying capacity. Rest all our patient would be pale but will not be anemic. Like one condition she said, suppose a case of nephrotic syndrome, body is edematous, you will not be able to elicit pain. A patient has coming with conjunctival injection due to some other cause, say autoimmune disease, say Kawasaki disease, paleness will be masked. Conjunctivitis, paleness will be masked. So there are conditions when pallor is there, anemia is there. Pallor is there, there is no anemia. Anemia is there, there is no pallor. All the conditions you have to know. Clear? So now what is the WHO cutoff value that we are talking of, about the 2 standard deviation below the population mean for the corresponding age and sex. All these words should come in the single go. Below the 2 standard deviation, below the population mean for the corresponding age and sex, right? So খুব সোজা মনে রাখার, I memorize it like this: 11, 12, 13, 12, 11. You go 11, 12, 13, then come back 12, 11, right? 11, 12, 13, 12, 11, and don't memorize at all. Forget memorizing. So between 6 months to 59 months, I mean 6 years, it becomes 11. Below 11, it is pale, right? So now in the different age group 6 to 14 years, it becomes 12. Now if it is adult, males, it is 13. Now in females, you have to get two conditions, pregnant condition, non-pregnant condition. In non-pregnant condition, it is just 1 gram per deciliter less, and still 1 gram per deciliter less for pregnancy because of hemodilution that happens in pregnancy, right? So tell me the mnemonic of anemia. 11, 12, 13, 12, 11 মনে থাকবে। সো এইখানেই পড়াটা হয়ে যাবে, বাড়ি যেয়ে বই খুলতে হবে না। On the basis of hemoglobin percentage, now you have to categorize. You know there is mild anemia, moderate anemia and severe anemia. If you go clinically, mild anemia cannot be detected clinically. Only moderate and severe anemia can be detected. Moderate anemia I have shown in the clinical classes, you will get later on also when you go for physical examination. So I am skipping that part. So here mild is, you see it is written more than 10 gram. More than 10 gram, that means 11, 12, 13, whatever might be. No, more than 10 gram up to the cutoff value. That means between 6 to 6 months to 6 years, it will be 10 to 11. Between 6 years to 14 years, it will be 10 to 12. Like this. That window will be for mild anemia, right? So moderate anemia would be 7 to 10, and 5 to 7 is severe, and very severe is less than 5. So that's how you categorize anemia according to the hemoglobin concentration. This is why we need to study anemia, because this is the present status of India. This data comes for NFHS 5. The results were published in 2021. So this is most current Government of India data regarding condition of anemia in children in India. This is overall all India statistics. Therefore, in our consideration, that is 6 to 59 months and 15 to 49 years, 6 to 59 months, average 67% of children are anemic, and picture is not very good in adolescents also, because I know adolescent data. In adolescent means between 10 to 19 years, their data is 31% of boys and 59.7%, take it around 60% of girls between that age group is suffering from anemia. So it's huge. So we need to study because of this. So how now approach? How to approach a case of anemia? So what are our standard format? One is what the parents will come, either mother, father or caregiver, and they will put some complaint in front of you. That you present as, what we call that? It is a history. That is known as history. For any time, if you are writing a note on approach to a case of so and so, A, B, C, D. So you approach it clear cut. You enumerate points in the history, you enumerate points in clinical examination, then go for investigation, provisional diagnosis likewise, right? So we have to first go for history. So fatigue, because of less oxygen available to the tissues suffer from hypoxia. Don't say anoxia. Anoxia is an absolute term, complete absence. That do not happen. So it is hypoxia. What will happen if there is hypoxia? How acidosis will develop? One by one. Why there will be injury? Why? There has to have some pathophysiology, no? Why lactic acid would be produced? এইটা কেন মুখ থেকে বেরোচ্ছে না? Because of hypoxia, there will be anaerobic glycolysis leading to more lactic acid production, leading to acidosis, leading to pH mediated enzyme inactivation, leading to metabolic derangement in the cell, leading to apoptosis of the cell. খুব clear cut. বোঝা গেল? Cascade one upon the other. So there will be fatigue, then difficulty in focusing. Actually, I don't know whether it is readable for you. You cannot make it out. So it is difficulty in focusing. Because of that, so your neuronal function is deranged. So focusing, your concentration ability, you develop irritable. Sometimes you become very lethargic. These are due to that. Then second is crazy. তাই না? Because of muscle hypoxia. Because of muscle hypoxia, muscular activity is less. Apathy, again the same reason. So these are the manifestations. So these are the anemia symptoms. You can highly read in the books also. But this koilonychia hardly, yes, this koilonychia, brittle nail, this most of the time it is a sign, sometimes it is a symptom if the parents complain of. So additionally, there may be some other features also here, like breath holding spell. What is suck rest suck cycle? Feeding difficulty. Do you know this? Anybody can explain? Hello. Well, this is an event during breastfeeding. That is clear. Fine. Thank you. So what happens there? There are two cycles during breastfeeding. Bolbe? Kyo bolbe? Yes, tell me. Very good. So what happens, you know, during breastfeeding, baby first suck, makes a sucking effort. That leads to pooling of blood within mouth. So baby has to swallow the milk. It has sucked in. So at that time breathing will be paused. Then suck, rest, again will start sucking when the mouth is empty, till the baby's appetite fulfills. So this is called suck, rest, suck. If the baby do not get milk after sucking, what is that cycle called? Suck, suck, suck. Baby goes on sucking. It's not getting milk. So there is no pause. So that cycle is called suck, suck, suck. What happens here? Baby cannot suck for a defined period. And after few suck, baby becomes tired and stops sucking against it. So the cycle repeats too frequently. That happens in any condition which leads to rapid breathing also. Poor cognitive function, irritability, all these things I think you have understood, but I want explanation, or if you can tell me, I have read physiology long back, no? Why perspiration over the head, forehead is there in anemia? So anemia is an hypermetabolic state. There are many other hypermetabolic states, like one, tell me two or at least one. Very good. Thyrotoxicosis. Very good. So in this case, cellular metabolism is enhanced. That leads to more water production. And also, due to this physiological stress, there is more adrenaline release. That leads to more sweat production. So that leads to this one. So why on face and forehead, not rest of the body? it happens throughout the body. But since it is the most accessible area, you can see this area, you can identify this earlier. Chalo, শেষ হবে না না হলে. So, diagnostic approach clues from the age. How you can differentiate in different ages. This is, I tell you repeatedly in the history taking, that in history taking what is the importance of age. So, this is one more sphere. If it is a newborn, you think of hemorrhage or hemolysis or congenital infection. You don't think thalassemia in newborn. Now, thalassemia কখন ভাববো? 6 months to 18 months. Nutritional anemia, it is very uncommon below 6 months of age. So, autoimmune anemia, again it is in adolescence. Then Hodgkin, non-Hodgkin's, again coming back to the adolescent or older children, because Hodgkin happens much earlier age than non-Hodgkin's lymphoma. So, Fanconi's anemia again by 4 to 6 years. So, that is the importance of age. Even a specified age, you should think rationally. In the background data, it will flash in your brain, oh, this is a 4-year child. So, these could be the possibilities, like that. So, gender, G6PD is a XLR, X-linked recessive. তাহলে autosomal dominant হচ্ছে spherocytosis. One member means almost all the members. Autosomal recessive is sickle and thalassemia. So, this genetic transmission you have to know like this. Community or geographic localization, from here they are coming. So, this is Kuch is Lohans, this is in Gujarat actually, Kathiawar, then Punjab is, their thalassemia is common more in Punjab. This is thalassemia, HBE is more common. D Punjabensis, sorry, HBD is more common in Punjab, HBE is more common in West Bengal, like this. Sickle cell again in the tribal groups, you know, in Odisha, Jharkhand, there it is more common. G6PD again in the same thing, Parsis, Bhansalis. So, these are the different community who suffer from this disease much more. Now, diet, a child having on purely cow's milk feed would more likely to suffer from anemia. Why? What? বল না, কি লেখা আছে? ও লেখা রয়েছে, তাহলে এবার বল, why iron deficiency develops in cow's milk feed? ভিটামিন সি অভাবের জন্য, B12, আচ্ছা, কাউজ মিল্কে ভিটামিন B12 কম থাকে, থাকে, ঢপবাজি করবি না, জানলে বলবি, নাহলে বলবি না, এই পিছনকে দে, ভুল বল, ক্ষতি নেই, কিন্তু ইচ্ছা করে ভুল বলবি না, ওটা নেই। Why? রিকোয়ারমেন্ট ফুলফিল করে না, তাই তো, রিকোয়ারমেন্ট ফুলফিল করে না। ওয়ান মোর রিজন ইজ a condition called cow's milk protein intolerance, where there is continuous bleeding because of this immunological phenomena, leading to more loss of blood. Second one, strict veg, because vegetable is a poor source of B12, you know. Goat's milk is, obviously you know there's folate deficiency is there. Pica, two reasons. One is plumbism, because in pica is, what is pica? What is pica? Ekটু জোরে, attraction to non-food substances, right? Very good. So, why then you'll develop, what is plumbism? Plumbism is effect of lead poisoning, very good. So, why pica, it will, plumbism will develop? Because the colors in these things, they contain lead, lead compounds. And then iron deficiency, because they are more prone to worm infestation and these things, because they are taking these things. So, hookworm and others are also more common, and because the child is taking non-food substance, getting nutritionally deficient as well, this leads to iron deficiency there, right? Cholestasis, you know, which vitamins will suffer if there is cholestasis? হ্যাঁ, ভিটামিন ডিটা তো লেখা আছে। ডি, আর কোনো ভিটামিন? এ, আর কোনো ভিটামিন? আচ্ছা, আমি যদি একটা উত্তর চাই কি বলবি? একটা উত্তর। ও বলে এ, ও বলছে ডি, ও বলছে সি। সবাই যেন মানে অ্যালফাবেটের পরীক্ষা দিচ্ছে, এবিসিডি শিখতে এসছে, যে যা খুশি বলে দিচ্ছে। একটা লাইনে বললে কি বলবি? Yes, fat soluble vitamins, because this help absorption of fat soluble vitamins. So all the fat soluble vitamins will be deficient. Vitamin A, E is relevant here, that's why it is mentioned. So drugs again, you'll read it, right? Bone marrow suppression. So symptoms: diarrhea, malabsorption, well, it will lead to vitamin E, B12 and iron deficiency. Milk protein intolerance induces blood loss, যেটা আমি বলছিলাম। Intestinal resection, again, that will lead to B12 deficiency, because intestine is the place for B12 absorption. Very good. So infections, giardiasis leads to iron malabsorption. Why? জিয়ারডিয়া কোথায় থাকে? ইন্টেস্টিনের কোথায়? এটা জানতে হবে। ডুওডেনাম। ইয়েস, হ্যাঁ, ডুওডেনাম। Bacterial overgrowth, again, that will lead to B12 deficiency. Fish tapeworm, B12, what is fish tapeworm? Dilatum. হ্যাঁ, তাই তো, ঠিক। তোমরা সবই জানো দেখছি। তাহলে ফিজিক্যাল এক্সামিনেশনে কি পাবো? There may be fever, may be there due to acute infection, collagen vascular disease, malignancy, and due to hypermetabolic state. Many times, even without fever, parents come with a complaint of আমার ছেলে জ্বর হয়েছে. So they feel like warm because of over hypermetabolism, but it is not fever. Jaundice suggests hemolysis. Obviously, hemolysis with jaundice. Jaundice with anemia will indicate hemolysis. Petechiae purpura, it may be coagulopathy, it may be malignancy, these things. Hypertension in renal disease. So these physical signs will aid you to the diagnosis. So that is how you call clinical approach. Growth failure in chronic disease, chronic short stature in Fanconi's, and malnutrition. Capiolate spot is present in Fanconi anemia. Petechiae purpura, again same thing. There is the skin rashes. You need to know what are the different types of skin rashes important in the management of anemia. So these things, petechiae purpura, erythematous rash, then butterfly rash in SLE, other collagen vascular disease. Now, if you go head to foot clinical examination, in the head you will get frontal bossing. In thalassemia, we will discuss this when you will go for thalassemia. Not wasting time here. Oh, hair on end appearance কোথায় থাকে? কি করে বোঝা যায়? আমি কি বলছি? এটা কি দেখাচ্ছি? ফিজিক্যাল এক্সামিনেশন। এখানে হেয়ার অন এন্ড পাওয়া যাবে না। But good, otherwise you have remembered this. That's good. So microcephaly happens in you get in Fanconi's anemia sometimes. Like this, glossitis and angular stomatitis. You remember these two are quite different. Glossitis, angular stomatitis, cheilosis, cheilitis. All these terms are different. They are not same, right? Pigmentation, Peutz-Jeghers syndrome. There is pigmentation of the mucosa from mouth to anus, right? And telangiectasia, Osler-Rendu-Weber syndrome. Extremities, if there is congenital deformities are found here in Fanconi's anemia. One more condition when you find congenital anomalies more common is pure red cell aplasia or diamond blackfan syndrome. That is one more condition. 30 to 40% of the patients they suffer, they have got congenital anomalies associated. Then spoon-shaped nail in iron deficiency koilonychia. So all these things happen, platinichia, koilonychia, all this happens in iron deficiency you get. Dystrophic nails in disc keratosis, because disc keratosis is a disease of collagen. Disc keratosis is a disease of collagen and keratin is part of the collagen tissue. So এটা ছবি দেখো, এই দেখো, দেখেছো 1 2 3 4 থামটার কি অবস্থা, this you get in finger, this is disc keratosis, দেখো nail condition, দেখেছো skin pigmentation দেখো, এখানে tongue condition দেখো, right? ঠিক আছে, megaloblastic anemia, but the tongue condition I'll tell you later on class. Beefy tongue, very good, beefy tongue, তো সব জানো দেখছি, and hyperpigmentation of knuckles, we very particular to notice this one, hyperpigmentation of the knuckles, this is in B12 deficiency, most of the cases you get. So in the abdomen you get, if you get hepatosplenomegaly, that is clearly indicative of chronic hemolysis, and with lymphadenopathy either it is malignancy, bone marrow infiltration and these things. CNS, well, we already discussed, you will get irritability, apathy, these things. So this is the hemolytic phases. In your next semester we will discuss this in detail. What are the components of hemolytic phases, what are the components of hypothyroid phases, how to differentiate between these different phases, what is nephrotic phases, like this. Phases means facial appearance, and these are the small nodular masses, if you can appreciate here, this one, these are due to immunologic phenomena. This happens in capillaritis, Osler-Endu-Weber syndrome. Kasabach-Merritt, you know, there is the giant or cavernous hemangioma. In Kasabach-Merritt there is associated coagulopathy. Kasabach-Merritt is a congenital condition, there is a huge pooling of blood and with associated coagulopathy, this is Kasabach-Merritt syndrome. And there is a skeletal deformity, you see this radius is almost absent here, right? So it is associated with hypogonadism and renal abnormalities. So that is part of Fanconi syndrome. So now after going through history and clinical examination, we should think first question. Now our question is the child anemic? How will go? By history, examination and parameters. Now there is anemia, that means there is involvement of the blood production. So many other things are produced along with RBC there. So it may be associated WBC anomalies also, it may be associated platelet anomalies also. If two of the cell lines are affected, either two of the three, it is called pancytopenia. So it may be a case of pancytopenia also. So is it a single cell line affected or all the cell lines are affected? That you have to think of. And what is the cause and type of anemia, that will aid you in the diagnosis and management. So ultimately you have to manage the patient. So now what is the cause? We broadly divide into, either there is less production or there is excess loss, means hemolysis, or blood loss. Either it is production is less or wastage is less, right? So wastage may be either there is loss of blood outside the blood vascular system, or RBC is damaged within the blood vessel, that is called hemolysis. Now, so decreased production may be due to different reasons. One is the কারখানাটা বন্ধ হয়ে গেছে, the machine has stopped working, so that is called marrow failure. Second হচ্ছে তোমার বাড়িতে সব ঠিক আছে, গ্যাসটা নেই, তুমি বাজার করে নিয়ে এসছো, সো তোমার যে মেটেরিয়ালগুলো দিয়ে তৈরি হবে ব্লাড, সেই মেটেরিয়ালগুলোর অভাব আছে, তার মানে নিউট্রিশনাল ডেফিসিয়েন্সি। সো আইদার দের ইজ নিউট্রিশনাল ডেফিসিয়েন্সি, অথবা তোমার কারখানা বন্ধ হয়ে গেছে, অথবা দের ইজ ওয়ান মোর কন্ডিশন। হোয়াট ইজ দ্যাট? তোমার বাড়িতে ঠিক 3টে চেয়ারই আছে বসার মতো, তুমি যে বসতে গেলে দেখলে 10 জন রিলেটিভ এসে আগে থেকে বসে আছে। ইয়েস, ভেরি গুড, বোন ম্যারো ইনফিল্ট্রেশন। So bone marrow is not having enough space to function properly to produce RBC. So these 3 conditions lead to decreased production. So first one is marrow failure. It will be due to aplasia, which may be congenital, like congenital this is inherited bone marrow failure syndrome. এটা আমি তোমাদের একটু হালকা 2-1 লাইন বলবো, তোমাদের বেশি লাগবে না। During iron deficiency anemia, so a decreased number of RBC products precursors, the materialটাই নেই তৈরি হবে কোত্থেকে। So that happens in pure red cell aplasia or diamond black fan syndrome and transient erythroblastopenia of newborn or infancy. These 2 conditions you have to differentiate, right? Because both present with the same type of clinical picture, whereas diamond black fan syndrome presents with more congenital anomalies, TEC with less, and there is 2 or 3 tests that differentiate these two. I'll tell later on. So impaired erythropoietin production due to chronic infection will come later, and decreased nutrient supply may be due to nutritional deficiency or excess loss by malabsorption, like again protein, energy, malnutrition. So all these 3 factors operate in decreased production, and last one is the bone marrow infiltration by storage disease and malignancy, these things. So blood loss may be acute and chronic. So blood loss means extravascular, hemolysis means intravascular, and third one is hypersplenism. These are the 3 mechanisms, right? So blood loss may be acute or chronic. Chronic blood loss টা দেখে রাখো, acute তোমরা এমনি বুঝতে পারবে। The worm infestation, Meckel's diverticulum, it presents with anemia, celiac disease. Intravascular hemolysis may be due to, তোমরা এইভাবেই পড়েছো তো, ফার্স্ট এইভাবেই পড়েছো তো নাকি ফিজিওলজিতে, এনজাইমোপ্যাথি, মেমব্রেনোপ্যাথি, হিমোগ্লোবিনোপ্যাথি, অল প্যাথিস, হ্যাঁ এইভাবেই মনে রাখবে, এনজাইমোপ্যাথি, মেমব্রেনোপ্যাথি, হিমোগ্লোবিনোপ্যাথি, রাইট? আর এক্সট্রাভাস্কুলার হচ্ছে অটোইমিউন হিমোলাইটিক অ্যানিমিয়া এন্ড হাইপারস্প্লেনিজম। এনজাইম ডিফেক্ট কি কি হতে পারে? 2টো পাথওয়ে মেনলি ইম্পর্টেন্ট, পেন্টোজ ফসফেট পাথওয়ে আর গ্লাইকোলাইটিক পাথওয়ে। তাহলে গ্লাইকোলাইটিক পাথওয়েতে হচ্ছে হেক্সোজ ফসফেট কাইনেজ ডেফিসিয়েন্সি অফ পাইরুভেট কাইনেজ, আর পেন্টোজ ফসফেট খুব ইম্পর্টেন্ট হচ্ছে G6PD, তাই তো? মেমব্রেন ডিফেক্ট কি কি হতে পারে? স্ফেরোসাইটোসিস, এলিপ্টোসাইটোসিস, আর হিমোগ্লোবিনে কি হতে পারে? থ্যালাসেমিয়া, ঠিক আছে? And extracorpuscular defect, that means extravascular hemolysis কি কারণে হতে পারে? It may be due to passive acquired antibody or active antibody formation. Active antibody formation কিসে হয়? Autoimmune hemolytic anemia. Passive কিসে হয়? RH or ABO incompatibility. তাহলে কি কি টেস্ট করবে? হিমোগ্লোবিন, হিমাটোক্রিট, এই টেস্টগুলো আমি বলছিলাম পরের দিন ডিসকাস করবো, তোমার বোঝাবো কোনটা কি। MCV, MCH, MCHC and peripheral smear, and classify in the morphological or physiological type. In morphological recover micro, macro and normocytic. এই স্লাইডটা ভালো করে দেখবে, এটা ইম্পর্টেন্ট, রাইট? ছবি দিয়ে বুঝিয়ে রেখেছি ইচ্ছা করে। এই ব্ল্যাক অ্যারোটা ফলো করে, এগুলো কি বলতো? প্লেটিলেটস। আচ্ছা, ব্লু অ্যারোটা ফলো, ব্লুটা কোথায়? এই যে এটা কি বলতো? আরে তোমরা সব জানো দেখছি, এটা হচ্ছে লিম্ফোসাইট। রেড অ্যারোটা কি বলতো? আরবিসি। আরবিসি কি দেখাচ্ছে তার সঙ্গে? সেন্ট্রাল প্যালার। আমরা কি বলি? উইথ ইনক্রিজ প্যালার। হাউ টু ডিফাইন ইনক্রিজ প্যালার? 1/3 এর বেশি পার্টি হলেই সেটা হচ্ছে ইনক্রিজ সেন্ট্রাল প্যালার, ডায়ামিটার ওয়াইজ। হ্যাঁ, diameter of the pallor is more than 1/3 of the total pallor, that means abnormal. হ্যাঁ, সেই তিনটে খুব স্পেসিফিক্যালি দেওয়া আছে। ছবিটা বোঝা যাচ্ছে পরিষ্কার? রাইট। সো হোয়াট ইজ দিস ব্লাড পিকচার? হুইচ ডিজিজ ইট ইজ সাজেস্টিং? মাইক্রোসাইটিক। দেখো ইনক্রিজ সেন্ট্রাল প্যালার, দেখো এখানে পরিষ্কার বোঝা যাচ্ছে ইনক্রিজ সেন্ট্রাল প্যালার বোঝা যাচ্ছে। সেলস আর স্মলার। সো এইগুলো প্রায়ই তোমাদের কিন্তু ক্লিনিক্সে তোমাদের এই প্রশ্নগুলো রিপিটেডলি করবে। So what are the causes of microcytic anemia? Give a short note on this. Short note আসতে পারে এইভাবে। Iron deficiency and thalassemia syndrome are the more common one, but these things, there are few others also. You have to remember chronic inflammation, lead poisoning and sideroblastic anemia, right? Macrocytic এইভাবে ডিফারেন্সিয়েট করবে, আমি পরে ছবিটা দেখাচ্ছি, এটা ভালো বুঝতে পারবে না। Macrocytic with megaloblastic bone marrow, without megaloblastic bone marrow. With megaloblastic bone marrow, you get the classical picture of megaloblastic anemia in B12 and folate deficiency. Without megaloblastic picture in the bone marrow, you get in these conditions: aplastic anemia, in diamond blackfan syndrome, congenital dyserythropoietic anemia. Because you know, in newborn, MCV is always more than 100. They are macrocytic normally. Gradually MCV goes down, down, down like this, whereas MCHC remains static. That is the history of different investigations. এইটা দেখো, তাহলে এইটা কি? এখানে কিছু লেখা নেই, কে কি বলে দেখি। কেন হাইপার সেগমেন্টেড হয়? কেন হয়? কেন হয়? So what is the function of B12 in the cell metabolism? একে বলো। কিসে সাহায্য করে? Maturation. So in B12 deficiency, what will happen? There is maturational arrest. এই কথাগুলো ইউজ করবে। There is maturational arrest. So they will go on increasing the lobes, leading to hypersegmented or polysegmented neutrophil. It is one of the clinical, investigation picture of macrocytic anemia. This is, দেখো এখানে কিন্তু কিছু কিছু মনে হচ্ছে এইটাই, যেমন মনে হচ্ছে সেন্ট্রাল প্যালোডটা বেশি, বাট মোস্ট অফ অল ওভারঅল যদি তুমি দেখো, এগুলো হচ্ছে প্লেটিলেট, এইগুলো, হ্যাঁ। আরবিসি, ডব্লিউবিসি খুব ভালো বোঝা যাচ্ছে না, এইগুলো ডব্লিউবিসি হওয়ার সম্ভাবনা বেশি, হ্যাঁ, মানে লিম্ফোসাইট হওয়ার সম্ভাবনা বেশি। সো normocytic anemia happens in acute blood loss or hemolytic anemia or chronic disease. So this is how, this is a very important slide. We test, in the OPD also, OPD diagnosis of anemia. This is another presentation. By seeing the blood picture, you can diagnose whether this is, 2 or 3 parameters. One is the MCV, MCH, MCHC and RDW. এই কটা তোমাদের জানতে হবে। সো ক্যান আই আস্ক ইউ হোয়াট ইজ MCV? আমি একটু সময় নিচ্ছি তাহলে, ক্লাস নেই যখন। হোয়াট ইজ MCV? হোয়াট ডু ইউ মিন বাই MCV? আমি ভ্যালু জানতে চাইনি, হোয়াট ডু মিন বাই MCV? Mean corpuscular, what do you mean by that? Mean corpuscular volume. That means average volume of RBC in the body, right? What is MCH? How it differs from MCHC? দুটো খুব কাছাকাছি নয় কি? একটা C এর তফাৎ। তুমি এরকম যেন বলো না স্যার ওটায় C আছে এটায় C নেই। Do you have any idea? Any idea? No? You haven't read in physiology? Physiology was not in your first prof, I know. Yes, agreed. Did you have physiology in your first prof? Huh? What does it mean? That means average volume of the RBC. It is measured in femtoliter. তাই তো? And MC এখানে নেই, MCH is the mean corpuscular hemoglobin, it is the amount of hemoglobin present average in each RBC. That's why it is given in picogram. It is given in picogram. But MCHC is the percentage of hemoglobin content of each RBC. So that's why if you say MCV is 80 to 100 normal, so always MCHC would be slightly more than MCH. কারণ 80 তে 10 আছে, তাহলে 100 এ কত থাকতো, সেটা তো পার্সেন্টেজ, তার 10 এর থেকে বেশি হবে। তো MCH থেকে MCHC একটু বেশি হবে। That's the rationality, right? Clear হয়েছে? And what is RDW? Red cell. What does it mean? Variation in RBC size. Variation in RBC size. Width এর কতটা ডিফারেন্স আছে? একটা খুব ছোট 10, একটা 30, so distribution width is more. একটা 10, একটা 11, it is less, right? So now depending on that, RDW may be normal or RDW may be high, it cannot be less, right? So normal RDW with low MCV commonly আমাদের দুটো ডিজিজে হয় জানো, মানে মাইক্রোসাইটিক, লো এমসিভি মানে মাইক্রোসাইটিক, দুটো কন্ডিশন বলো, থ্যালাসেমিয়া আর আয়রন ডেফিসিয়েন্সি। এখানে RDW will guide you. In iron deficiency RDW would be high. তাহলে তুমি ব্লাড পিকচার দেখে বলে দিতে পারবে না না এটা আয়রন ডেফিসিয়েন্সি, এটা থ্যালাসেমিয়া নয়, এটা ট্রেট নয়। তো শুধু শুধু HPLC করার দরকার নেই, ওকে আয়রন দাও ঠিক হয়ে যাবে। দ্যাট ইজ ক্লিনিক্স, and you save patients money. সেকেন্ডটা দেখো, নর্মাল এমসিভি আর নর্মাল RDW মানে কি? নর্মোসাইটিক অ্যানিমিয়া, no anemia or normocytic anemia. And with high RDW, it can be, these are chronic diseases, that is liver disease, kidney disease, malignancy, myelofibrosis. How this happens, I will tell you later on the anemia on chronic diseases. What are the factors, how it develops, what is the pathogenesis of anemia in chronic disease. And this high MCV may be megaloblastic, non-megaloblastic, as I have told you. Remember like this, high MCV may be, that is macrocytic, it may be megaloblastic bone marrow, non-megaloblastic bone marrow. Megaloblastic হচ্ছে B12 আর folate deficiency, non-megaloblastic হচ্ছে Diamond-Blackfan syndrome, aplastic anemia, immune hemolytic anemia. These are non-megaloblastic with high RDW, right? So from CBC you can diagnose most of the causes of the anemia, not the etiological cause, type of anemia. Depending on that, you have to go for further testing. Suppose you find it's a case of hemolytic anemia, so you go for investigation of hemolysis, like that. G6PD, Sickling study, electrophoresis, Coombs test, osmotic fragility test. It is not done nowadays, still it is in the list, it should be deleted. Then in case of malignancy or infiltration, you go for bone marrow study and membrane and enzyme studies, right? In biochemistry, these things, stool examination, oviparasite and urine analysis. See here one thing, oviparasite they have not mentioned about cyst, because cyst do not cause disease. Special investigation, in case of autoimmune hemolytic anemia, you go for ANA, other virological tests if necessary. Endoscopy may be needed if you think of chronic GI blood loss, say for colonoscopy or upper GI endoscopy, whatever might be. Imaging, well, US abdomen skeletal radiographs are needed for Fanconi's anemia and these things, malnutrition, these things. Tissue biopsy needed for conditions, and NGS at the very late stage. Newer RBC parameters, you can skip this thing, only nucleated RBC you can remember, nucleated RBC. So, this is a very early parameter. Nucleated RBC is a very early parameter of increased bone marrow activity. Increased bone marrow activity, because RBC initially it is nucleated there, then it loses nucleus, then comes out in the blood. If it is pushed too frequently, too early, nucleated RBC would come in the blood. That's the only thing. And this is immature reticulocyte fraction. This is another important investigation upcoming in the modern days. When the platelet production is very much accentuated, this IRF function would be more, immature reticulocyte fraction, because of the same reason. So, what is the take home message? Meticulous history and examination is very important. Baseline lab test is most important investigation if you are going to type and find out the cause of anemia, and newer tests are gaining popularity, but the cost is more and availability is also much less. So, that is what we wanted to discuss today. Should I rewind or stop here? Stop here? Okay. So, মনে থাকবে আজকে যেগুলো হলো, I'll rather request you to come with a bit of study whoever comes, and please to come. These classes will not be repeated, and hematology investigation you need to know whichever stream you go for in specialty later on. Particularly medical subjects you have to do. Even you go for pathology and these investigations, you need to know these things. So, this is the baseline approach, right? Thank you.